I called up the executive producer of Nightly News. I was supposed to be the lead story that night. And I said, you know what? I'm supposed to be live, but I just found out that I have cancer. And so I think maybe going live isn't the best thing.
Welcome to Believe in Progress, the American Association for Cancer Research Foundation podcast. Join us and be inspired by the incredible stories of those who have faced cancer with strength and resilience, and the medical professionals who are working tirelessly to find new treatments and ultimately a cure. Believe in Progress isn't just about the science of cancer. It's about the human side of this disease. Together, we can make progress in the fight against cancer and bring hope to those who need it most. Welcome to the Believe in Progress podcast, brought to you by the American Association for Cancer Research. I'm your host, Mitch Stoller, Chief Philanthropic Officer at AACR. Today, we have a renowned storyteller, cancer survivor, and advocate for innovative cancer treatments. Kristen has transitioned from telling impactful stories from NBC's Today Show and Nightly News to spearheading efforts in accelerating the development of a breast cancer vaccine with the Cancer Vaccine Coalition. Join us as we delve into her inspiring journey and the groundbreaking work of the Cancer Vaccine Coalition. Kristen, welcome so much to Believe in Progress. I have to tell you, I'm so excited to have you here today. I had the good fortune of meeting you in April at the AACR annual meeting, but welcome and so happy to have you.
Thank you, Mitch. I'm thrilled to be with you. I'm surprised to be with you. If you had told me this time last year that I would be talking about treatments for cancer to you as an advocate, I would not have believed it. But it's been an exciting journey, and I'm really excited to be living in this space now with so much hope for the future.
So, can you take us back past a year and talk a little bit about your personal journey and as a storyteller of NBC and a great one at that, to becoming now this wonderful cancer advocate, and you are a cancer survivor, but I'd like to hear more about that story.
Yeah, and that's really what changed things for me. So, I was a network correspondent with NBC covering, hurricanes and earthquakes and all sorts of natural disasters and elections and everything that comes to a national reporter. And, I loved doing it. I had a long and successful career. And I was going about my business and I was happy, and I thought I would stay there for the rest of my career. And then in 2019, I was diagnosed with breast cancer. So I had had a clear mammogram in May of that year. And then on my 47th birthday, I was getting ready to go out and I noticed a dent in my breast. And it was something that I thought back to a story that I had done on a study. We went to the Mayo Clinic. We reported how 1 in 6 women doesn't present with the traditional lump. So you may have discharge or dents or dimpling. And so it was enough of a red flag for me that I knew that I needed to get it checked out. And my husband was really encouraging me to get it checked out, even though I had had that mammogram. I didn't realize I had dense breasts. And so while I may have gotten a letter, nobody really explained to me what it meant that I had dense breasts and what additional screening I could and should be doing. And so when I finally had a mammogram and ultrasound, and I was actually covering a hurricane in North Carolina when that happened, everyone else was leaving the beach and we drive into the storm, and I called the local hospital and I said, this is going to sound strange, but is there an opening? Did anyone cancel today? And so I was able to get in, and they said, well, why don't you wait until you get home? And I said, I just really need to do this. I know my body. I know something's different, and it's really important. And I think that became my message initially, was know your body, recognize any changes, any differences, and get them checked out. It turned out that I did have stage 2 cancer.
Did you go to that hospital, by the way? Did you actually go to that hospital?
For treatment, I went to that hospital for the diagnostic mammogram. Right. And then when I heard that it was really likely cancer, I called up the executive producer of Nightly News. I was supposed to be the lead story that night. And I said, you know what? I'm supposed to be live, but I just found out that I have cancer. And so I think maybe going live isn't the best thing, just in case something starts to process in that moment. And, I never want anything to interfere with the show. And so I taped a segment and then I drove to the airport. And on the way to the airport, one of my colleagues, Andrea Mitchell, who's a really well
Of
known
course.
NBC
Yeah.
correspondent, called me, and she had been through breast cancer. And she said, okay, can I put you in touch with my doctor, Larry Norton? I said,
Oh,
absolutely. And so at that point, I was with the best of the best and, felt like I was in good hands. I flew home to get my biopsy. And Andrea actually offered to spend the night with me as I was waiting for the flight because she knew it's really hard to be alone in those moments. And we knew each other as colleagues at that point. Now I consider her a really good friend,
of
but
course.
I just thought that was so generous of her. And that's what I found in this community and what really inspired me to also pay it forward to do what I can for other people. Because once you hear those words, you have cancer, you're changed. And unless you've been through it, it's hard to understand. And so this is just a really generous, welcoming, warm, and helpful community who would do anything for each other. And so while nobody wants to be a part of it, I do feel really blessed that I'm surrounded by these people.
Yeah, it's a pretty scary thing to learn about, that's for sure. Um, so when you found this, so this story that you did, I went back and I watched that story. That really that prompted you not to wait, not to wait for because if you waited, things could have been a lot worse, right?
Yeah,
What's your
much
advice to people,
different.
like other people that you talk to, and not just with breast cancer, it could be any type of cancer.
Exactly.
What do you tell people and talk to people about?
Yeah, I mean, I think that had I not done that story and known that personally, I would have put off um, my diagnostic mammogram. And even if it had been 6 or 8 months later, it would have been during COVID and I might have put it off and said, I'll go get it. So I feel really lucky that I took it seriously and that I went because I did already have lymph node involvement. And had I waited any longer, it could have been a much worse prognosis. And so I think the message is just, you know, know your body, look for changes, pay attention to changes, and get things checked out. And I say that, and we're going through something in my family again where my dad was having a lot of gastric
Right.
issues, and he was going to get them, going to talk to doctors, and everyone was saying, well, don't drink dairy and cut out gluten, but nobody ever did a colonoscopy. And so I also think that you have to be your own advocate. And it's not that, your care team isn't good, but feel free to ask questions
Yeah.
or ask for additional screening if
Hmm.
you think it would help. And obviously, there's the insurance issue as well, but it's really important to be your own advocate. So I think those are the two biggest things: is just know your body and be your own advocate.
And your dad is dealing with colorectal cancer. How's he doing?
He's okay. He's in the middle of chemotherapy,
Yeah.
and it's not easy,
Right. Right.
but he's a fighter, and he's hanging in there, and he's in good hands as well. And so we're really hopeful. Um, but I'm also hopeful that someday, and I know we'll get to this, but that someday there are better options for people, like
No
vaccines,
doubt.
and like these cutting edge treatments that we're seeing. I love the name of the podcast, Believe in
Oh,
Progress,
thank
because
you.
I feel like, that's what changed my life, is believing that we can change things, we can do better, and that we are going to see this incredible progress that's going to make, you know, cancer diagnosis so much
Yeah,
easier for
I have
people.
to be honest with you. The whole impetus for the name first came from Ted Lasso, and just what remember
Yep.
believe, and
Believe, of
I
course.
love that whole philosophy, and then we just so what are we about? We're about making progress and doing something impactful. And speaking about that, and let's talk about your crusade, if you will. you're on a mission. I could see it in April when you were gallivanting around the AACR annual meeting, which is not necessarily a real easy task because there's so much to cover there. But talk a little bit about the beginnings and what you're thinking about with the Cancer Vaccine Coalition. I think it's really, really important work, and love to hear more about
Thank you. Yeah, I think my head was literally spinning
it.
when I met you the first time because I, I had never been to a medical conference
Right,
before, and it
right.
is just overwhelming. It's huge. There's so many people in all the booths and everything, but it also was really exciting to be a part of it. So, fast forward, I went through my cancer treatment, and it was 2023. So, yeah, just last fall. In talking about early detection and dense breasts and doing some advocacy and some stories on that, I was introduced to Dr. Nora Desis at the University of Washington because she's working on some vaccine development. She's at the Cancer Vaccine
Yes,
Institute. And I had a conversation with her, and I was reluctant because I was like, I'd never heard of cancer vaccines. They must not be very far along or a real thing. I'm a medical reporter. I've had cancer, I haven't heard about it. And so I was kind of skeptical, and I went into it. And she explained the science to me and just where they are. And I was absolutely blown away. She told me about a HER2 positive ICD study that they had done 10 years ago, and now 85% of the people who got that ideal dose, the second dose, are still alive at 10 years out when they were late stage HER2 positive breast cancer. And the median survival rate for metastatic HER2 positive breast cancer is only 5 years. And so, something was working there. And then in talking to her about this moment in time, and she told me that we now have a better understanding of the immune system than we ever have before. We know what parts of cancer can be targeted, and we have the vaccine technology, mRNA and DNA, to
right,
develop it thanks to the advances that were made during COVID
right.
19. And so it's those three things coming together. She described it as a tipping point. And when we had that conversation, I just knew that I had to get involved because I couldn't stand to see people waiting for these treatments. And we were talking about, well, how long is it going to take? And under the current system, decades was the answer. And so, if there's that technology, and I think I was enough of an outsider to say, well, wait a minute, why don't we do things better? We just saw during COVID how we advanced 10 years of science into 8 months. And so, there was a group of us that put this together. The scientists signed on really quickly. And so, we have scientists from Memorial Sloan Kettering, from Dana-Farber, from Cleveland Clinic, from MD Anderson, and from University of Washington, as well as Roswell Park, who were like, yes, we would all love to work outside of our silos. And, they're not collaborating on a single vaccine, but they're sharing ideas and they're having conversations. And together we're trying to figure out, how do we get this to move quicker? And so it became clear really quickly that this was a big task.
Yes,
um, and so I realized that I would have to leave NBC because I couldn't do both things at the level I was doing
right,
them. And it came at a good time for me to do that. And so in January, I went on the Today Show and announced what I was doing and the promise of vaccines, and that I would be leaving NBC. I still have a lot of great friends there and a good relationship with them.
right.
But this felt really important and really like the time is now to do this. And if I wasn't pushing it and I didn't see anyone else doing it, we would have to wait. And so I get emails from people every day who don't have time to wait,
Right.
who are, late stage, and waiting for of, some type of answer for
Yeah.
them. And vaccines may be it. We're starting to see the conversation changing. I just got an email before I came on from NCI, and they were talking about, using immunotherapy in solid tumors and the success that they're seeing in a very small study. And so there's something going on. It is this sea change towards this. And so it's an exciting time to be helping. I don't pretend that I'm the scientist that's going to do it or that I even know what they're talking about a lot of the times.
Right.
But, I'm a connector, I'm a hub. I describe it to people as Cancer Vaccine Coalition is creating an ecosystem where this can move quicker. And we're starting in breast cancer, but obviously the name allows us to go and support other cancers as well down the road.
Well, I love it.
And so we're just trying
Yeah.
to make things go faster. Yeah.
I love that. I love being a connector. I mean, people have called the AACR the honest broker because we can, kind of sit in the middle of government and pharma and academic and seems like you're doing very similar, if not the same thing. I did look up Dr. Desis, and she's been a member of AACR since 1999. And I'm sure a few of the other scientists that are advising are also members. So it's something that we've been talking a lot about at AACR. I'm curious to know what some of your strategies are going to be with the coalition. What are you thinking about? How are you going to make change, and how are you going to make those advances?
Right. I mean, so there's a few things. The way it's been described to me, our first meetings, we ask the scientists, where are your pain points?
Right.
What is slowing this down? And so I don't think it's a surprise to anyone that funding is an issue. We're talking about proven concepts. And so in, phase one, a lot of phase two studies. Um, and that's the valley of death for vaccines. So, the way I sort of visualize it is you've got your early phase, Dodd grants or philanthropy, you've got your late stage pharma coming in, and there is that gap in the middle. So if we can do something to kind of bridge it, maybe bring this a little sooner, bring this a little farther, and help them with funding. So raising money is part of what we're
Of
doing,
course.
an important part of what we're doing. And we hope to fund our first trials later this year. We've got a second site for one of Dr. Desis's trials for metastatic triple negative breast cancer. So she's starting it at University of Washington. Roswell Park, who's in our coalition, is going to be a second site. And so we're really close to that trial and excited about opening that up. And that just, gives us geographic diversity, gives us ethnic diversity. And it's setting the framework of these hospitals, cancer centers working together and scientists working together on this. So that's really exciting. I look at what one of my goals is, and in March, I was introduced to Dr. Leonard Lee from Oxford and started to see what they're doing over in the UK. And then I was invited to his Great Britain Cancer Summit,
Mm-hmm.
Cancer Vaccine Summit. And it was an incredible day where I learned about this goal to get 10,000 cancer vaccines. There's actually not one in breast cancer yet, but in other cancers into clinical trials in the next few years. So these widespread clinical trials. And it's really incredible. They're already starting in colorectal patients. They're working on melanoma vaccines, head and neck cancers, glioblastoma, and brain cancers. And so there's the development from the pharmaceutical companies. And then what the NHS over there is able to provide is this network and the hospitals and the patients.
Right.
And so, perhaps we can do something here. And I presented this to HHS a couple of weeks ago at their National Vaccine Advisory Committee. Maybe we can be that platform. And while we don't have a nationalized healthcare system, we can get a collaboration together of cancer institutes or of physicians for referring and for administering cancer vaccines. And so if we leaned in a little bit a la COVID-19 vaccine, I think we really could make some progress here. And so that's one of my goals. So continuing to talk to all of the stakeholders, government, pharmaceuticals, obviously the academics, fundraising, patient advocacy groups, because we're going to need to enroll trials quickly to get
Absolutely.
things moving. And so there's a lot of great groups that are already working on that and getting names of people and getting diverse populations into these trials. And so, we're working with them. So it really is this collaboration, not just of the scientists, but of everybody, who wants this to happen. And I can't think of a person who hasn't been impacted by cancer in their family or friends or
Yeah.
coworkers. And so it is getting the smartest minds into a room together to figure out how to move it forward and then to do what we can to support that. It's communications, it's fundraising,
Right.
and it's making the
Starting a not-for-profit organization is no easy task. And there's, as I think I heard you say on an interview, you were volunteering and you're a volunteer, but you're starting an important nonprofit. Can you talk a little bit about that and some of the challenges you're finding with that?
Absolutely. Mitch, I wish you had told me back in January that starting a nonprofit was
I would have
hard.
been
You,
happy to tell you. And also,
you could have saved me some headaches. No,
I
I
throw
mean,
this out to you as well, and I think you already know this, but I'd be delighted to certainly lend any help I can to advance your mission, and because it's near and dear to my heart as well.
thank you. And I will take you up on that for
Please.
sure. Yes, this is one of the hardest things I've done professionally. And I'm working harder than I ever have.
Right.
I had certainly spurts at NBC where I was covering Hurricane Katrina or something, and it was 24/7. But this really is like a constant to grow this. But it's a labor of love, and it's really one of the most exciting things I've done as well. And I just have such hope. I talked to Dr. Barker at the AACR meeting,
Yes.
and I kind of asked her to see if I was on the right path. Like, what are you thinking about this moment in time? And she said, I have never in my entire career been more hopeful about, you know, treatments and cures than I am at this point in time. And so I think this is a really unique and special moment. And while there have been amazing advances, throughout history in this space, and certainly we've developed treatments that saved my life, um, but I think this is really hopeful that we could also change the experience. So, while I'm alive and I'm grateful, going through cancer of any kind is not easy. Chemotherapy takes a toll on your body, radiation takes a toll on your body. Amputating a part of your body is something that is going to impact you for the rest of your life, and you're never going to feel the same in your body. And so, that and then all of the emotional tolls are a lot. And so this feels really, really important and also hopeful for future generations and for the people that are, getting diagnosed, or we're working with some people who are BRCA positive and very young,
Yes.
18 and 23. And so it would be wonderful if we were able to get a vaccine before they have to make some of those difficult
Right.
decisions. And so, the clock is ticking, and that's why I'm working so hard, because every day there are people dying from breast cancer, from cancer. And so it feels really imperative to accelerate the process as much as we can.
Well, I think you hit on collaboration a lot, and I think one of the big keys that we try to reinforce at AACR is scientists collaborating, but community collaborating as well. And so I know we at the foundation we talk to a lot of the patient groups, and we want to work with the patient groups because there's no need to duplicate things, but there is a need to really harness everybody's energy and work together, because that's how we're, I think, going to get future make a impact quicker, and so I applaud what you're doing with that, and I encourage you to keep thinking in those terms.
Thank you. Yeah, and AACR has been so wonderful and supportive. I wasn't sure how I would be received in this space. I mean, look, I'm an outsider. I'm a journalist. I'm not a cancer researcher. And everyone recognizes that I'm here to support the science and the researchers
Right.
and the people that are doing this incredible work. And to have AACR behind me and supporting us in this journey and being willing to help in the way that you have and have conversations with me behind the scenes has been amazing. And it is, you hit it with, we don't need to repeat things. And
Right.
if we could just build on everything, and get things advanced instead of working in our own silos and just doing something that never sees the light of day and is shared with anyone else, well, then we are setting the clock back decades. And so that collaboration is absolutely the key to this.
So when you were at the AACR meeting, you had quite a partner with you and Ms. Rothberg showing you around, who we all love very much here. But what was your impression of that scientific meeting? Because again, I know I'm a lay person and I go sit into some sessions, and it's amazing to see the scale of the science. But to me, it's also amazing to see the young investigators absorbing information and kind of like you know networking and writing down. And I think one of the things, Kristen, that we're always really thinking about and we're a little worried about is that cancer workforce. And so anything we can do to keep promoting, and again, it's funding. It's funding that cancer workforce, so we know we have a bright future. But I just love to know what your impressions were of our scientific meeting.
Yeah, and this is a funny story because I was introduced to Saren through a mutual friend. Um, I had seen some of what she was doing with her Comedy Cures and her podcast, and but we talked on the phone for the first time, and she said, "You have to come to AACR. I know you don't know me, but I'm going to take you to AACR." And we talked a few more times, and she was like, "I got us a hotel room," and we just hit it off on the phone. It sounds so strange to be sharing a hotel room with a woman you've never met. Um, but we hit it off. We had these mutual friends. So, I knew enough about her that I was at least safe. And we just had the best time. And we did her podcast
Yeah.
in our pajamas one
Right.
day, and talking about just what we were learning. And it's an incredible experience to see all of these scientists and young scientists presenting their hard work and what they work all year on, to be able to advance treatments and cures, and making people's lives better, and patients' lives better. So it's overwhelming to be in that space as a survivor and know just how hard everyone's working,
Hmm.
to make sure that you're okay and that you live and that you have a bright future ahead. And so that was kind of an emotional part of it, just seeing how many people are working on this.
Did that give you a different perspective on things?
It did. I mean, look, I didn't think I was going to come in and snap my fingers and everything would be cured. There's a lot of people who have been working on this
Yes,
for a long time, very hard. And so it just gave me, I loved my care team already, and I knew that they were
of
dedicated
course.
and had sacrificed so much in this space, to make patients live longer and healthier lives. But it was just really neat to see all of the young people with their posters and think about, wow, some of these things are going to be what we're seeing
Yes,
in the next decade, and the
absolutely,
things that are going to change lives for the people that come after me as a patient. And
absolutely.
so that's a really exciting part. I love the survivor scientist program.
Yes.
I think that's so fantastic, to give survivors, many of whom are advocates, the chance to learn about the science of their disease and of the future, science and medical advances that are coming through. And then it also just was a lot of fun. Um, I did not expect to see Dr. Foti dancing out there at one of the parties.
Well, come to Chicago for the next year's annual meeting. You'll see her.
It was an amazing time, and I felt really lucky, to have Saren,
Yeah.
sort of shepherding me around and introducing me to the right people. And I'm really excited to be back next year.
Well, she's great. She actually, I interviewed her for the podcast, and she actually had me telling jokes on the podcast. So, she's pretty persuasive, and a great advocate and a great volunteer as well. So, how has cancer changed your perspective on, I guess, your outlook on things? We didn't really talk about family and caregivers and things of that sort too, but I'm just wondering, if you're willing to chat a little bit about that, um, has your perspective changed on life and even just your outlook on things and your family's journey, I guess, as well?
Yeah, I know some people are like, "Oh, I'm fine after it." I think that it changes you to the core. And I don't think I'm unique in that. It yeah, it made me really look at priorities, and I moved my family because I recognized that this was time to be near grandparents and to be in a place that felt healthier for me outside of a city. So there were those types of decisions. I recognized how important my family was, and that spending hours commuting every day didn't fit into me being present as a mom and as a wife. And so, there are those decisions where you really get to look at your life. It's almost a blessing in some ways where you can say, okay, let's put the brakes on. What's important? I may have gotten off track or been, following these things which were important at the time, but now what do I really want? It makes you think, if I only have, a certain amount of time left, which all of us do, how do I want to spend that? And so it was kind of a reminder of, look at your life, do what's important, live where you want to live, be surrounded by who you want to be surrounded by. And then it allowed me to take this crazy leap into doing this that I don't think I would have done a few years ago, because the safer path was staying in my career and doing that. I had a recurrence scare a couple of years ago, and there was something on my brain and we were monitoring it. And so the way you can tell if it's cancer, is it growing? And so you have this, 5 to 6 week period where you're just waiting and you don't know, and you're going to go in for another scan and see what's there. And so, obviously your mind goes crazy with, what if this is a metastases, and what do I do then? And in thinking about that type of time crunch, I said, well, I want to be with my family and I want to impact the world. And that never left me. And so I think, it was nothing. And but I knew, okay, the things that are important to me are my family and helping people and using my voice and my platform to fight for change. And so when this project came up, it really just felt organically like the right thing to
Hmm.
do in my heart for me. And my family fully supported me. So that changed, cancer just changed so much. And then you asked about caregiving, and now I'm a caregiver. My dad just moved in with us recently, both my parents. And so you see it, and I swear it's harder to see someone you love going through it than it is to go through it yourself.
Hmm.
Um, but again, you're kind of confronted with, I want to make the most of this time and this person who has meant everything to me for my entire life.
Hmm.
How can I, help and give everything to that person? So, cancer is like just the great reminder of, do the things that matter and say the things that you need to say, and, spread your love and your light as much as possible.
That's fantastic. Well, I have two daughters, and they're wonderful. And it sounds like you're you're a wonderful daughter to your dad. So I applaud you on that. Do you miss journalism?
Um, We had a big rainstorm here last night,
Yeah.
and I was thanking my lucky stars that I was inside and dry
Right.
and not covering flooding. I miss some things. I do feel content in that I did so much over my career, and I traveled the world, and I've seen so many things. Um, so I feel like I did it. I miss my friends. Occasionally I'll miss the rush of breaking news
Yes.
and being a part of it and getting your front seat to history. But I'm also really happy doing
That's
this
great.
and being with my family more. And so much of what I'm doing, you mentioned daughters, is like I have an 8-year old.
Okay.
And so I want the future to be different for
Of
her.
course.
We don't have any hereditary breast cancer risks that I know about. Um, but, you know, gosh, if I can make it so that she doesn't have to go through all this. And so that's another thing that's really been important for me is taking care of other people's daughters, sons, people who are the next generation who are going to be facing these
Well, I feel
diseases.
the same way. I have two, I'm blessed to have two grandsons, and I don't I work hard every day for their futures, and also obviously for my daughters and my wife, and I think your outlook is fantastic. How do you handle setbacks? And I know, in the cancer journey there are setbacks from time to time, maybe even failures, and perhaps what lessons have you learned from those?
Yeah, I think I've always been someone who just can keep my eyes on the future and the hope. And so setbacks are hard, but knowing that, your path is still there and you might have to climb up a little mountain to use an analogy, but like you'll get to the other side of it. When I was going through my chemotherapy, and this isn't necessarily setbacks, but I was able to chunk it out. So, I had 8 treatments. I'm 1/8 done after the first one.
Right.
And then I was a quarter done. And so for me, it was like, okay, I'm just going to take those baby steps and and always keep my eye on the prize and how much closer I'm getting to the end of this. We've also had, it's funny, I say there's more drama in nonprofits than in television news sometimes.
Mm,
So we also
could be.
have, have had some things with, we started as Pink Eraser Project, and then we did a restructure and a rebrand into Cancer Vaccine Coalition. Um, which may have set our timeline back slightly, but I think it allowed us to have a much stronger organization, a much stronger structure. When I named it Pink Eraser Project when we were starting, it was because I was afraid that people would not want to hear anything about vaccines and
Hmm.
that we would get sucked into that debate. And even when I announced it on the Today Show, I said, don't write me. These are never vaccines that are going to be mandated by the government. And we only really got two that I can think of nasty grams about vaccines. And, they basically said, oh, great, another vaccine.
Right.
And the majority of people were all for it because they recognize that cancer vaccines are going to be voluntary. They're going to be therapeutic, at least to start. And so they fit into your treatment, which also includes pumping toxic chemicals into your body and amputation. So, like, you know, we're not in that debate. And so my point in all of this is that what may have been a setback actually allowed us to rebrand and now to have this much clearer name about what we're doing. We are a coalition that is promoting cancer vaccines.
Focused, very focused.
Yeah. And so, that setback, there's always a silver
Yeah.
lining in things.
Love it. Yeah. Last question for you. And I always like to ask this question of all my guests is a little bit about mentorship, and have you had on your journey, both I guess professionally and personally, have you had mentors, and what have they meant to you in your journey?
Oh gosh. I mean, I think mentorship is so, so important. I had plenty of mentors along the way in journalism and people who I emulated. I would, go read their scripts and then ask them questions about how they wrote certain things or how they did certain things. And then, in cancer, it was beyond what I ever expected. I mentioned Andrea Mitchell, so
Yes.
she kind of talked me through some of what it was going to be like, and that was really important. And then other people I'd never met got on the phone with me. I had a 3-year-old at the time. And so somebody that I know's niece who had just gone through breast cancer called me, and she and I spent hours on the phone talking about how do you talk to young kids
Right.
about cancer. That
Right.
was a real concern, and I wasn't getting much guidance, from the hospital.
Hmm.
It came down to other moms who helped me through that, and so she was really valuable. She also talked to me about cold capping. There's so many decisions that you never think of,
Yes.
and then you have to make really quickly. And so, I decided not to do it, but just having people who had been through it. And that's kind of what I started with is this is an amazing community that is so generous with their time
Yes.
and then also so willing to offer advice and to be your mentor. And it may sound strange to someone who hasn't been through it to have a cancer mentor, but there's a lot. And, I had another friend who's an ICU nurse at Memorial Sloan Kettering who had gone through breast cancer. She made Tuesday her day off so that she could sit with me in the infusions every Tuesday or every other Tuesday and,
Unreal.
help me through it. And so Karina Stone was a huge, huge mentor to me in this journey. And I think, everyone is paying it forward, and that makes a difference to the people that come next. And, now I'm trying to do the same both for people going through it and then also for people in our organization. We are still all volunteer.
Yes.
And, we hope at some point to be able to get the funding to hire more people. But the fact that people are so passionate about it and volunteering, what I can do for them is maybe lend them some of my experience um, in this process and help them to get where they want to be. So, yeah, mentors are
That's
everything.
awesome. Well, Kristen, it's been a delight to have this opportunity to have a conversation with you. We're behind you all the way. We want to collaborate and work with you, and the Cancer Vaccine Coalition, I believe, has a bright future. I love its focus, and I think that's really, really important. And I know all of our scientists throughout our network of over 58,000 members are probably extremely interested in this as well. But you are a gem, and we really appreciate your efforts. We appreciate what you're doing out there in the community, and keep it up. And anything we can do, we'll do it, and we'll make this happen for you. And you're already making it happen. But thank you so much for giving us a few minutes of your time today.
Oh, thank you. Happy to do it. And everybody join us. It's going to take all of us.
Thank you, Kristen Dahlgren, for sharing your powerful story and the incredible work being done through the Cancer Vaccine Coalition. Your journey from storytelling to becoming a beacon of hope in cancer advocacy is truly inspiring. To our listeners, thank you for joining us on this episode of Believe in Progress podcast. If you want to learn more about the Cancer Vaccine Coalition and how you can support the development of a breast cancer vaccine, please visit cancervaccinecoalition.org. That's cancervaccinecoalition.org. You can also find a link to their website in the show notes for this episode. Remember to subscribe to our podcast so you never miss an episode, and share this podcast with many, many friends and family to spread hope and awareness. Your support is crucial in the fight against cancer. Please consider making a donation to the American Association for Cancer Research at AACR.org. Every contribution helps advance life-saving cancer research. And thank you once again for listening. Until next time, keep believing in progress and the power of innovation in the fight against cancer. This podcast is produced by CollegeCast LLC. And remember, cancer research saves lives.